So, here's the real question. How do dentists like you, who aren't willing to let insurance dictate how you will run your practice, who want to create incredibly profitable practices without sacrificing your time or sanity, how do you create the strategies to ensure your practice not only survives, but thrives in the 21st century? That's the blaring question, and Dr. Steve Schalintz is here to provide the answers. Welcome to Dental Practice Freedom Radio.
What is up, everybody? This is Dr. Steve Schalintz. I want to welcome you back to another episode of Dental Practice Freedom Radio. I am so excited to be able to share this little, I'm calling it a mini-series, right? So these 4 episodes. If you're tuning in and you're just getting this one, I recommend you go back 2 episodes, okay? And we're breaking down the entire new patient process that I use in my practice to establish a new patient. And we covered the interview on the last episode. We covered the history of the episode before then. Today, what we're going to do is actually cover the exam process itself. Now, I actually think the exam process, or what I call to the patient a guided tour, is the least important part of the entire process. It's still vitally important, but it's the least important part. But for most dentists, it's the part they focus on the most, right? So I think that the soft skills of the interview and the initial review of findings is a much more important thing to focus on than the actual exam process. So this is the shortest part of what I go through with a new patient. I don't want to overwhelm them here. So, and I see that happen all the time in practices. The doctor will completely overwhelm the patient, and the patient will say something along the lines of, "Doc, that was the most thorough and comprehensive exam I've ever been through." And when I heard that, when I first started, I was like, awesome, they're going to keep coming back. And guess what happened? They never came back. I actually overwhelmed them. I got them to a point where they didn't want to come back. And I knew something was wrong. And I see that happen all the time with dentists. So if a patient tells you it was the most comprehensive exam they've ever had, it might be a great thing, but it also might not be a good thing. So I want you to be thinking about that. So I'm going to break down exactly the process. So you remember in the interview I talked to the patient about health and disease, and we're going to see where they're at in the process, right? So because of that, what I'm going to start to do is compare everything to those pictures of health and disease. And I told the patient, all we're trying to do is get a snapshot in time of where you're at today, okay? So the first thing I do when I put them back, I say the first thing I want to do is actually take a panoramic image of all of your teeth. Now, if you have a cone beam, you want to use that as an overall picture, and you want to, go down that route, that's fine. If you want to take a full mouth series, that's fine too. But you got to get something that incorporates the entire mouth, okay? So even if they've had previous radiographs, they always get a pan in my office first, because that's the first thing I want to go over with them. And when I go over a pan, so we take the pan with the patient's now sitting in the chair, and the first thing I do is bring that pan up on a screen in front of them, and that is the first thing we look at, okay? And when I'm looking at the pan, I'm telling them, this is what I'm looking at. I'm not necessarily just looking at your teeth. I'm looking at the entire structure. I'm looking at the jaw joints. I'm looking at the sinuses. I'm looking at the jawbone. Then I'm looking at the teeth. I'm looking at the ligaments around the teeth. I'm looking at the bone levels around the teeth. And I want to get a picture of what your system looks like. Not what your teeth look like, your system. I want them to start thinking bigger, right? You're not a tooth mechanic. You're a physician of the mouth. So you got to use language like that, the system. Right? So the pan is first. Then one of my secret sauce, and I learned this when I was at the Schuster Center, and I bought the program, and I bought all this stuff, and I don't recommend you have to use structured charts, but you could. There's a whole philosophy that goes behind it. I'm not going to really dig into the philosophy in this podcast episode. It's just too much. That's an entirely different podcast episode. But when you go through it, I don't care if you call it a dental fitness program, a dental fitness graph, an oral assessment, whatever you want to call it, a periodontal assessment, a periodontal exam, a periodontal charting. You want to say it in a way that a patient will understand. So I say the dental fitness exam, because this really tells us how healthy your gum and bone is, and how healthy subsequently your teeth are going to be. So what I do is I literally have a chart with them, and I show the progression of periodontal disease in very simple to understand terms. And I'm explaining to them why we use shout out to Andre Sheridan. So Andre Sheridan, he talked about not saying probe, saying ruler. So when you get your periodontal ruler out, Andre, if you're listening to this, I paid attention at the summit. I really did. You have a ruler. And so the ruler is going to go around your tooth and it's going to measure how healthy the gum and bone is. And I go down and I actually describe it with a graph. I say, your gum is like a turtleneck. So around the tooth, there's a bone, and then there's this turtleneck of gum tissue. And a healthy turtleneck is 1 to 3 millimeters, which is just a little space. But what that means is you can actually get to the bottom of that little turtleneck with your toothbrush. Now, if the numbers get bigger, what that means is there's a bigger gap. There's a bigger space there. And so you can actually get down all the way with your toothbrush. So what we're trying to do today is identify, do you have turtlenecks that are healthy, or do we need to assist you a little bit so that you can make sure you get to the bottom of those with your toothbrush? So we're looking at that number, okay? We're also looking at plaque. And plaque is the white sticky stuff that stays on your teeth, and if it stays on your teeth for 24 hours, it produces a really strong acid which eats holes in your gum and your bone and your teeth. That's the language I use with the patient. I'm not trying to tell them about periodontal disease. I'm trying to tell them what's going on a daily basis. And so I said, I'm looking for that plaque because I know if we can eliminate plaque, we can eliminate disease out of your mouth, especially when it comes to tooth decay and gum disease. And I got to go back. Actually, I missed something in my last podcast episode, so this is a bonus. So when you're going through your interview process, you really do want to break down the 3 main diseases that people have: tooth decay, gum disease, and bad bite. I totally skip that. I do it every time. I always talk about that in my interview, so I apologize. You want to talk about tooth decay, gum disease, and bad bite. Tooth decay and gum disease, I learned this from TJ Bolt, and I use it all the time, Dr. TJ Bolt. He said, tooth decay and gum disease are diseases of choice. You can choose not to have them if you don't want to, because we know what causes those diseases. Bad bite, on the other hand, is something you probably need assistance with. So if you have what we consider to be occlusal disease, you simply can't brush that away. You're going to need our help and support. And we're going to look at that today and see if you have a tendency to get occlusal disease. So I wanted to throw that in there. It's probably going to throw off the rest of this episode, but you need to understand that as well. So when you're going through this now, you talk about plaque. And we know if we can eliminate plaque, we can eliminate the majority of disease in your mouth. And then the last thing we're looking for is bleeding around those areas. So around that turtleneck, if it bleeds when we get this little ruler in there and measure it, we know that gum tissue is unhealthy. It's inflamed. It's got disease with it right now. Like if I touched your skin and you started bleeding, you'd be a little bit concerned, right? Well, your gum tissue is the same as your skin, and if you touch the gum tissue and it starts to bleed, we know that we have active inflammation, infection, and disease there. We need to take care of that. And so at that point, I said, do you understand what I'm trying to get across? And they said, yes. I said, okay, so what we're going to do today is actually measure how healthy your turtlenecks are, how much plaque you have, and then how much bleeding you have. And so what I'm going to do is go around each tooth. Now, I know this is in depth, but I think this is the most important thing you can do in your practice, period, bar none. It's changed my practice. I've done more comprehensive dentistry by doing this exam first before I do anything else. Because what the patient starts to do is connect themselves to the disease. They now have an active role. They need to know and they need to pay attention. So I say, what I'm going to do is I want you to follow along with me. When I go around this tooth 6 different times, I'm looking for plaque first, then I'm looking at the number, and then I'm looking for bleeding. And so if there's plaque, I'm going to say yes. Then I'm going to have the number, and remember we were looking between 1 and 3, and the higher the number, the worse the gum and bone levels are. And then I'm looking for bleeding, so I'm going to say another yes or no. So if you hear something like yes, 3, yes, then it's because you have plaque, you have a 3 millimeter pocket, and you have bleeding. If you hear no, 3, no, that's really good. That means there's no plaque, there's no a 3 millimeter pocket, so you can keep it clean, and there's no bleeding. Does that make sense to you? And they're going to say yes, and you know what? The reality is the first time you go through this exam, they probably aren't going to get all the numbers anyway. And so I go through that whole process. So I literally chart out every tooth the first time. I don't do it the second, third, and fourth time. I go down to 4 sites, or Courtney or Carrie, whoever the hygienist is, and they go down to 4 sites to make it a little bit faster. But as I'm going through that, I stop right at the midline, right between 8 and 9, and I sit the patient up, and there's a graph that they can follow along. That's all part of the structured chart. And then I say, so what did you hear? And I want to check in to see how involved they are, because this one that one question will tell me a lot about this patient. If that patient checked out and I had a lot of yeses and 5s and 6, and I asked them what they heard, and they said, it sounds good, I know they're not engaged with me. So I either have to reconnect them or ask them some more questions. But if they start to go, I heard some yeses and some nos, and I can't quite remember what the first yes was, but I know I'm supposed to be hearing more nos than yeses, and yada, yada, I know I have a very engaged and active patient. So I go through that entire process, and when I get done, I actually have a chart up on the screen, and they can see how much bleeding they have, they can see how much plaque they have, they can know exactly what areas they are in the mouth, they get a little handout, and I tell them, I'm like, the reality is if your plaque and bleeding score were above a 90 and it's scored in the positive, so that means 90% of the areas were plaque and bleeding free, I know the chance of you getting tooth decay and gum disease are almost zero. And most people aren't going to be at that number when they start, but they have something to shoot for, and trying to get them to shoot for 100. The whole point of this is to get your patients into a goal-setting mode so they're involved in the process of taking control of their own disease. So important, can't go into it too much more depth, but it's really vital. It's really, really vital, okay? The next thing I do is a general exam. And literally all I'm doing, I used to do a lot more thorough, and I would talk about all the, like where the teeth surfaces are and stuff. With the advent of pictures, I don't do it nearly as much because I'm going to show them pictures at the review of findings. So I go through, I check for active decay. I might snap some pictures of teeth so they know what the teeth are looking like. And I really just kind of a cursory exam. I don't go into too much depth there. Unless the patient has obvious TMJ pain or something that I want to take a peek at, I look at levels of wear. I might palpate the joints, but I really don't do anything at that point. If they have TMJ pain and they come in for that, I do a TMJ assessment. But if I think they have TMJ problems, then what I'm going to do is, have them come back for a later appointment for more thorough records. Remember, all we're trying to do right now is get a snapshot in time of where this patient currently is on the disease spectrum. The last thing I do is take pictures. So I take a standard set of 6 pictures, and every dentist does this a little bit differently, but I do want to see occlusal surfaces. I want to see a frontal shot, a smile shot, a sagittal shot, and open, close slightly, laterals, just the basic stuff, right? And all I'm trying to do is get an assessment. And when they're done, I tell them kind of what I'm seeing and where they might be at in the spectrum that we talked about in the interview. And then I send them on their way. And I said, we're going to come back in about a week, and I'm going to talk to you about, the state and condition of your mouth, and we're going to decide together what you want to do, because I can't guess for you what I think you want to do. So we're going to go through all this stuff together and just look at it, and I want to make sure we start on the right foot. So I think it's very important for us to know exactly where you're at today and exactly where you want to go in the future, and then we can start to create a plan together, very important you say together, to get you to that future that you really want. Is that okay with you? And 99.9% of patients will be fine with that because you've done such a good job in the exam. They understand the value of coming back free of charge for a review. I don't charge for a review. I think this is the most important thing you do. And so I want them to be involved in the process. Now, some people are like, man, I really don't have the time. If they don't have the time and it's a genuine, thing, I already know it's going to be very difficult to probably do any type of comprehensive dentistry because they don't understand the value, even after I spent so much time with the interview and the exam. But I know that up front, so I'm not going to be going out of my way to continue to try to set up a review, right? Most patients, though, understand the value, and they really do want to talk about where their mouth is currently at, and their intrigue is usually peaked at this point because no dentist has ever went through a process like this with them. So hopefully you got some, tidbits and some things. I know it's hard to talk about all this stuff in a podcast episode. Literally, in the course that I teach, Dental Sales Secrets, I go in this in a lot more detail and a lot more depth and walk you through this process over, video after video after video, because I do think it's absolutely important that you do that. So if you guys are interested in that program, this is a shameless plug. I encourage you to go to right now, as you're currently listening to this podcast, dentalsalessecrets.com/webinar registration. And my guess is by the time you're listening to this, if you just go to dentalsalessecrets.com, it'll direct you to a webinar registration page where you can learn more about this entire process, and then you can learn more about the program Dental Sales Secrets so that you can understand how to take this information and actually put it into your practice. So when you are on the next episode, you are going to hear me talk about the actual interview itself, which brings it all home so patients are on the right foot with you. And I think this is absolutely essential as well. So hopefully you got some value out of this, and I'll see you at the next episode.
Thank you so much for listening to this episode on Dental Practice Freedom Radio with Dr. Steve Schlintz. We'll see you on the next episode.